Thank you for taking the time to learn about the OSF Weight Management Clinic. My name is Jenny Ray. I'm a registered dietitian and coordinator of the Weight Management Clinic. This video is part 1 of a 4-part series. In this video, you'll learn 2 things: the best strategies for weight loss and the programs that we offer to support you in your path to a healthier lifestyle. If you're watching this video, I imagine that this is not your first time trying to lose weight. Like the woman shown in the drawing, you may have tried losing weight many times in the past, only to regain the weight you've lost, plus more. This is called yo-yo dieting, and I'm guessing that you want this time to be different. The question is how. So what's the best way to lose weight? This is sort of a trick question because there isn't one best way to lose weight. There are many evidence-based strategies that can help. These include eating lower calories overall, spread between 3 meals each day, and a couple of snacks if needed. Try not to skip meals. Meal replacements can be a useful tool. This includes shakes, bars, or even frozen meals. And keeping a food record can help you learn from your habits and keep you focused. It's also important to balance your time between movement and sleep. Work your way up to 150 minutes per week of exercise and limit the time you spend sitting in front of the TV, phone, or computer. Good quality sleep and enough hours of sleep can help regulate your appetite and other hormones that may impact your weight. Of course, good nutrition and exercise are just one piece to the puzzle and often help with a modest weight loss of about 5 to 10% of your body weight. If your goal is to lose more than 10% of your body weight, we may explore other options such as weight loss medications or surgery. Finally, we must remember there is no quick fix. Each person may have a different plan, but everyone will do best with support and sticking with that plan for at least 6 months. Before I tell you what we do at the OSF Weight Management Clinic, here's a look at what we won't do. We will not use weight loss supplements or put you on an extreme fad diet that is temporary and not realistic for your lifestyle. We will not do extreme personal fitness training that leads you to exhaustion and injury. So what do we do? First, we need to meet you and assess your situation. At your first appointment, you'll see the whole team: nurse, physician, advanced practice nurse, dietitian, and exercise physiologist. Each person is different, so we need to find the path that fits you best. Part of your assessment includes a BOD-POD test. This is a simple 1-minute test that measures your body fat and lean muscle mass. This test requires a little preparation, so we will schedule this as a separate appointment. Now let's look closer at the programs we offer. Option 1 is Pathways to Health. This is a small group class, 10 people or less, that's led by a dietitian. You'll meet once each week for 4 weeks, then every other week for 5 months. Then you can continue meeting once a month for the next 6 months. You'll learn about developing healthy eating habits and take steps to get started with exercise. You'll keep track of your food and exercise and weigh in before each meeting. If you're unable to meet this frequently, we do offer an option that meets just once per month. The second option is the HMR program for weight management, using the Healthy Solutions Meal Plan. This is a national program using meal replacements as a tool for consistent weight loss. An example day of the meal plan is shown here, which includes a minimum of 3 HMR shakes, 2 HMR entrees, and 5 full cups of vegetables and fruit. The estimated food cost is about $100 per week. Once you've met your goal weight, we help you transition from meal replacements to home-cooked foods. Group meetings are available if you need extra support, but that's optional. To learn more about the HMR Healthy Solutions Meal Plan, I've included a link along with this video. The third option is Pathways to Surgery. Weight loss surgery is a useful tool for weight loss, but like all tools, it's useless unless you know how to use it. This class will prepare you for weight loss surgery where you'll learn the 5 lifelong habits for surgical success. This is a small group class, 15 people or less. You'll meet once each month for 5 months, begin to make healthy changes to your diet, and get started with exercise. You'll keep track of your food and activity and weigh in before each meeting. Now, if your schedule does not match with our group classes, or if you live several hours away and have difficulty driving to Peoria on a regular basis, then the fourth option leaves room for flexibility. With individual counseling, you can schedule monthly appointments with our team, either in person or on video. You will meet one-on-one with our physician or advanced practice nurse, dietitian, and exercise physiologist. This option can be used for weight loss counseling or to support you in using the HMR meal plan or to prepare you for weight loss surgery. So in summary, weight loss is not a quick one-size-fits-all kind of package. We want to get to know you and walk with you on the path that leads to healthy living for good. If you're ready to get started, your next step is to call your primary care physician and ask for a referral to the OSF Weight Management Clinic. Once we get the referral, we'll call you to set up your first appointment. Our clinic is located on the second floor of the Riverplex Recreation and Wellness Center in Peoria. If you have a permit for handicap parking, you may use any parking space marked with either a handicap reserved parking sign or the permit parking only sign shown here. Thanks for listening, and we look forward to meeting you soon.